remain also in all patients remain depend of the age of the patients. So in the infants, in the neonates, the problem is the venous access. That is very difficult, and we have now we use to start prophylaxis in the first years of age with subcutaneous therapy. So we start subcutaneous therapy in the first year, and then start intravenous after 6 months, 1 year, and every every 10 or 15 days. This is important. But also in this case, we have the problem of venous access. So obviously, the possibility to have factor VIII concentrate, to use factor VIII concentrate using subcutaneous or oral is obviously in unmet needs, no? But I don't know when is it possible. But and the other problem is the extension, the frequency of the need of number of infusion that the patients need to have a good results, a good level of factor VIII. So now we have the extended life concentrate, but it's not for all patients. Not for all patients have the same results. So we have patients, especially for hemophilia A. For hemophilia B, we have the better results. But for hemophilia A, we have patients that use extended life, but it's necessary to do 2 or 3 infusions per week. Now, probably in the future, in the near future, close future, we have new drugs, and this is results that in the recent Congress in Bangkok, we have some news, but we know that this drug probably in 6 or 1 year we have the possibility to use. Another drugs that have a really this is a really extended life, and so we wait this drug for the patients. I think that is a revolution like emicizumab, because I think that is a very important drug. We know that the results in some patients that we treat in the study, these patients have a level of 20% of factor VIII, about at 7 days at 20%. So it's very good results. And so we wait this drug in the next year probably. And unmet need, other important unmet need in hemophilia patients are, I think, in the adolescent, especially in adolescent age, the possibility to have subcutaneous and a drug that is possible to infuse, to need to make the infusion every 7-10 days. It's very important for the compliance in these patients, because in this age it's very difficult to have the response from the patients. The patients frequently avoid the therapy, and so it is a very difficult age. And the last one is probably the gene therapy, that probably we have good news in hemophilia B, but in hemophilia A, also in the last Congress, we have news not too good, not too good, because we know that the activity of the gene probably after 5 or 6 years back to 5% of factor VIII. So it's difficult to present to a patient a new drugs, a new procedure so complex, because it's complex, but only for 5 days, 5 years. So we use gene therapy in other diseases like thalassemia, like sickle cell, and in these patients we have a more long response, and in hemophilia probably, and also in pediatrics not possible. We treat especially pediatric patients. So in our patients is a therapy that is not actually is not possible.